Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm here with Dr. Sharon Green, and today we're talking about Powassan and Lyme disease. Doctor, what is Powassan and how does it differ from Lyme disease?
Powassan is a virus. It's actually closely related to West Nile virus, which is transmitted by mosquitoes. The difference is that Powassan is transmitted by ticks, and the relationship is that Powassan and Lyme disease are transmitted by the same tick. And now we have yet another tick-borne illness.
What are the symptoms of the Powassan virus disease?
Most people who get infected with Powassan virus don't have symptoms. However, when people do get sick, they will get encephalitis. Encephalitis is an inflammation of the brain, and so symptoms could be weakness, confusion, seizures. And it's a very serious infection, so it has about a 10% mortality rate. And of the people who do survive, about half of them have permanent neurologic problems.
How soon after do people get sick after being bitten by an infected tick?
So with Powassan, it's 3 days to about 2 weeks. For Lyme disease, it's out to about a month.
What is the treatment for Powassan?
So unfortunately, there isn't any specific treatment because it is a virus and it's relatively rare. In the United States, there's only been 75 cases of Powassan virus infection recorded. However, it came to Massachusetts only in 2013. And this year, because we're seeing many more ticks and mice and more Lyme, then it's predicted that there will be more Powassan as well.
How can we avoid these tick-borne diseases?
So the best way to prevent it is to avoid the places that have ticks. So if you stay inside, you won't get it. But if you do go outside, there are some things you can do. The most important thing is to cover yourself up. So long sleeve, long pants. If you're going hiking and you know you're in an area with tall grasses or in the woods, it's important to actually tuck your pants into the socks because the ticks will crawl up. They like to be in dark places. They'll land in your armpit, in your groin, in your hair. So you really need to make sure that you wear the clothes. You can spray your clothes with permethrin or actually soak them and treat them with permethrin, which will kill the ticks on contact. And any exposed skin, you should be wearing an insect repellent that is useful against ticks, such as DEET.
What should you do if you've been outside and you think you may have been exposed to one of these ticks?
Well, so obviously you want to do a physical tick check, but there's a good chance that if you've been in an area that the ticks may be attached to the clothing and not to you. So the CDC recommends actually that once you've been out in an area that you think has ticks, to take the clothes off and throw them into the dryer on high heat. Or you could wash them at high heat. And for more information, I recommend you go to the CDC website.